And a campaign has sprung up over the course of the last week, and they're calling themselves the NHS 100,000. That's the estimated number of people within the NHS that have not had the vaccine. I'm told the figure could be slightly lower now. It could be 85,000. But still, there are people out there who, whatever the threats to their jobs, appear not to want to have this vaccine and are facing losing their jobs. Well, joining me to discuss all of this is Karen Moore, a registered nurse with more than 25 years of experience working in the NHS and you regularly give immunisations, I understand, but you're not keen to have the vaccine yourself. Good evening.
That's correct. Thank you. Thanks for having me. Yes, I do give vaccines. I've never given the COVID one. I'm not prepared to give something that I won't have myself, but I do give childhood vaccines, travel vaccines and the traditional vaccines, if you like.
Right, so you're not, so we can't put you, Karen, in the anti-vaxxer camp as such then?
No, absolutely not. I spent this morning in a baby clinic giving vaccinations to babies and young children. So no, certainly not. I'm not anti-vax. What I am is I truly believe in freedom of choice. I've had parents who decline their vaccinations for their children. That's their choice. We may not always agree with it. But if the mandate goes through, it isn't really my concern isn't so much that, no, I don't want this jab. I'm not at a high risk of COVID. I'm actually covering in other surgeries for staff that are triple jabbed that are off with the virus. And they're calling me in to cover those shifts. So how does it make sense for me to have a vaccine for something that I'm at very low risk of, for a vaccine that doesn't prevent the disease, doesn't stop the spread, but because of that, I'm at risk of losing my job in April. But I can work up until then. The government would say, Karen, the government or some of the hawks in the government would say that by not having the vaccine, you are posing a risk to patients. How would you answer that charge? If I'm posing a risk to patients, why am I still working? Why haven't they told me to redeploy me so that I'm not face to face? Well, they're giving you they're giving you a deadline, aren't they? They're giving you a deadline. But do you? I mean, look, if somebody has had, if a nurse has had the vaccine next to somebody who's not had the vaccine, are the government right in implying that the person that has not had the vaccine is posing a greater risk to patients? In my experience, no, because I'm actually covering for staff that have now had their boosters. So they've had 3 vaccines and they're off quite unwell with COVID in certain surgeries I'm working in. I've worked all through the pandemic. From the very beginning, I wear my PPE. I hate wearing my PPE. I wear it. I do all of the infection and prevention control that I've been taught from years down the line. As far as I'm aware, I've never put a patient at risk, and I would not do my job if I thought I was at risk to a patient.